guess we don't really see them in kids a lot, but they could happen. So I stabbed the ganglion with a 15 blade, and now you're watching me drain the ganglion. So ganglion cysts are common in kind of everybody. There's no gender or age group. I guess we don't really see them in kids a lot, but they could happen. So I stabbed the ganglion with a 15 blade, and now you're watching me drain the ganglion. This is actually a recurrent ganglion in this patient. He has had multiple ganglions and a couple drainages. So you're seeing me get that ganglion fluid out of there. Fun fact, it's sticky like jelly. Gross. Now you can't use jelly on your toast today. So you will see that I'm really pushing all around the ganglion. I'm trying to get as much fluid out of it as possible. And sometimes if there's like a little wall in the ganglion, you'll see like it either kind of has to pop, or you'll see my finger like push way harder than previously. The beginning ganglion fluid's easy to get out, but the end is harder. And ganglions are recurrent, at least 50-50. Sometimes I say more. Sometimes the ganglion will come back in 5 hours. Sometimes the ganglion won't come back for 5 years. If they come back in 5 hours, I normally recommend cutting them out in the OR. I always say ganglions are like M&Ms. So M&Ms have that soft chocolate center, and the outside is a hard candy shell. Ganglions have a soft gooey center, and the outside is like a sack. And so if you don't remove the whole entire sack, technically they could recur easier. And so sometimes we'll take them to the OR, numb up the patient really well, make an incision, and take the sack out. But again, sometimes patients don't want to do that. It's not super painful. It's just preventing them from wearing their shoes. And so we'll just drain it in office. Sometimes we stick a steroid injection in there to try to shut that sack down, but that doesn't always work either. The beauty about these is that they don't even have to have a stitch. We just put a betadine wet to dry dressing on them. The patient leaves that on for 3 to 5 days. Sometimes they'll change it at home if it accidentally gets wet. And then they don't have to have any follow-up.